Hello, Joanne.
Hi, how are you today?
How can I call you?
You can call me Jody.
Jody. Jody is quite weird from Joanne, isn't it? It's a bit far away.
Yes, it came from my twin brother when I was little. He couldn't pronounce my name, so I've always been called Jody.
Jody. It's a beautiful name, as your original name, Joanne, as well, is beautiful.
Thank you.
Jody, we're here today to talk about your experience. Your experience with a very awkward heart disease, and which you had, and it was colon cancer.
Yes.
Can you tell us how did you come around to think that you have colon cancer?
Well, initially I had a little bit of stomach pain, but I have celiac disease. Over the years I've had a lot of stomach issues, so I didn't really think anything about it. And I was doing work back in the UK and doing a lot of lifting, so I thought it was muscle pain here. I then came to the UAE and I became really tired. And initially I thought it was the heat. Oh, I need to get used to the heat again. But as the time went on, I just couldn't get through the day. And then I noticed that my stools were different. But then again, I thought it's due to my celiac disease. And one day I found blood in my stool. So then I went to the doctor and they done a colonoscopy. And that's when they came and said that I had a big tumor blocking my colon.
And how did you take the news?
I was very shocked indeed, because having celiac disease, I hoped that it had been something that irritated my bowels or something. And you just think that your life has ended right there. I thought it was the end of the road for me. But then I started talking to you and I started talking to nurses here. And pretty quickly I got hope. I started reading articles of people who came through cancer, and I just got hope then from that point on.
Do you know what stage you were in?
Yes, stage 4.
Stage 4.
So we done the scans, and again that was a very trying time, because you have to wait on the results and you're thinking, oh, please don't let it spread through my body. And it had spread to my liver, having 3 lesions on the right-hand side of my liver. And that was scary as well, because you think, oh, it's spread. What's next? So yes, I came to you and you said, okay, the best thing is we do surgery, because the tumor was blocking my intestines. So that's what we did.
And we did the surgery for the colon, right?
Yes, and that was done within 2 weeks of diagnosis. Yes. Yeah.
And you recall we said that when we discussed the treatment for colon cancer, is we staged it, right? So
yes.
We had the surgery for the colon, then we went on giving chemotherapy.
Yes.
And then after that, we had the surgery for the liver.
Yes.
Right? So your experience with the colon surgery itself. So how did you feel prior to the surgery, during the surgery, I mean, the very close period, in the perioperative period, and then when you went home? Was there any changes in your lifestyle? Did you feel that you're missing your right colon?
No, initially, to be honest, I had no time to worry about the surgery, because it happened so quickly. It's just like, okay, you're having surgery, and I just went with it. I let it just happen. I was very nervous, obviously, as everyone is, but it was a great experience because it was done by yourself, laparoscopical. So I was in and out of the hospital, and the healing time was pretty quick. I was able to do everything, obviously not lift things, but it was a very good experience.
That's very nice.
The only problem issues was with my bowels, because you notice then a big change, that you're kind of constipated.
Yes.
And 3 weeks after, I went straight into chemotherapy, which also has a big impact on your bowels.
Yes. And as you know, when we remove part of the colon, the creation of the colon, each part of it is based or does a certain activity. And so, and beside that, the chemotherapy also causes constipation. So your body will have to readapt with the missing part of your colon, so that we will go through fluctuations, will go through distension, will go through constipation, sometimes diarrhea.
Yes.
And I'm sure you have recognized that there are certain foods you used to eat before the surgery. Now they are a bit agitating.
Yes. I pretty much stay away from corn and corn-based things, just because I think that it kind of, well, it was advice from yourself as well, and I try not to eat it before I eat a lot of spicy food. I haven't actually tried it, but...
No, you should. You should start trying. You should go back to your normal life.
Yeah.
And then you went through chemotherapy, right?
Yeah. So that was another nerve-wracking experience, because nobody knows how your body is going to react. So me being myself, I just thought the worst. Okay, anything can happen. And actually, it was a much better experience than I could ever have imagined.
So going back to the chemotherapy and glass, especially for colon. Chemotherapy for colon is different than chemotherapy for breast or any other disease. So we don't usually compare one to the other. And one of the issues is the neuropathy for colon, as you said. You were talking about your kids.
Yes. Yes.
Can we know more about them?
Yes, I have 3 children. So the eldest is 20, but she's in the UK studying. I have a son who's 18 and a daughter who's 13, and they're both here with me in the UAE. So my 18-year-old son is a great cook, which has been amazing, because I've kind of put it on him the days I have chemotherapy. Oh, mom can't touch anything. So then he cooks me dinner, and they've been amazing.
So family makes a big difference.
Family makes a huge difference, yeah. And they fully understand. Again, at the beginning, it was a big shock for the kids as well. They were like, oh, mom has cancer. But when they slowly saw that I can pretty much do everything, then they're happy. I can still be a mom.
Yes. So we know that we started on with stage 4. We started on with cancer in the liver as well as in the colon. If I am to ask you today, do you think you have cancer anywhere in your body?
I think no.
Yes, and I agree
no.
with that.
I hope no.
We believe no.
We believe
because we know that cancer care is really based on our way of accepting the fact and our way of seeing how are we going to be, right? So when I know that I'm cancer-free, then I am cancer-free. And now you are still on chemotherapy, if I understood
Yes,
correctly?
I have 5 more cycles, and it is more to wipe out any cells that's floating around my body.
True. And how are you coping with that?
Good. I've had 1 and 5 to go.
That's good. That's good. Do you have any questions for me?
Yes, I have one question regarding the bowels. If now at the moment there's no telling when I need to go to the bathroom and it's all messed up, will that get better?
Yes. So usually whenever we do a colon surgery, it takes around a year until our body adapts.
Right.
And leave aside that now you are taking chemotherapy. Chemotherapy itself as well causes some issues where it does play a game with constipation, with altered bowel habits. So physically, when you finish your chemotherapy is the real time when we're going to get to know. But what we usually tell the patients is within a year, you should get back to your actual everyday habits. You might be going to the toilet twice a day instead of once a day.
Yes.
But it will get back. It will form and norm into a normal way after that.
That's good.
And the surveillance, right? This is something which we have to keep in mind.
Yes.
There is no strict guidelines for surveillance, but I believe we have to do every 6 months surveillance for the first 3 years.
Okay.
And then after that, it will be yearly.
Okay. Yeah.
Right?
That's good. Okay. Well, thank you very much.
Thank you. Can we sum up your experience with us here in Mediclinic? In a way or another, how were we as staff, as caregivers, as part of your little army, taking care of you? And do you think we did an acceptable job, a good job? Did you feel home with us? Did you
Yes.
feel it
Yeah,
cold?
I feel like the staff did an excellent job here and still are. My whole experience from the moment I came here, and I'm still undergoing treatment, has been amazing. The staff are friendly. The thing I like about Mediclinic is the staff are very attentive. So one day I was walking in the hospital and a nurse said, "Are you still here?" So she knew me. And that's what I like about Mediclinic. They don't treat you like a number, they treat you actually like a patient, which is
Well,
very nice.
I used to, and I do say to my patients, you know, remember when you first signed with me that consent of surgery, the agreement that you accepted me doing a surgery on you?
Yes.
Well, I always tell my patients that's a consent of life. So physically, I'm a lifetime owned as a physician by you and in charge and responsible of your care. Any day, any time, throughout the years. This is something like you come into our family. You are a member of our family today.
Yeah.
I have few thousands of family members, and we do care for our patients.
And that's great because even when I was with a different hospital for my second surgery, I called you and you helped me, and that just gave me such a great feeling to know that you were helping me and backing me up. And yeah, it's been amazing. So thank you so much.
Thank you for coming, and thank you for accepting our invitation on this.
Thank you.
Hopefully with this we'll be able to help other patients. I want to explain to them that colon cancer is not something we need to worry about. It just requires a strategic plan.
Yes.
To abolish it, to end it. And plans do vary from one person to another. And the most and utmost important part is the willingness of the patient for cure.
Yes.
And I can see that in you. At the beginning, when I first met you, I was worried, you're going to be a bit don't tell me anything, don't explain to me, I don't want to know. But to say the truth, I was positively impacted and impressed with your willingness to be cured.
Yes,
and I'm happy for you.
Thank you so much. Thank you so much.
All right. And I think by this I will thank you and we'll end it.
Okay.
Unless you have any questions.
No, I'm good. Thank you so much.
Thank you. Hi.
Hello.
Do I know you?
Good afternoon. Salam alaikum.
Wa alaikum assalam. You're among the very few people whom intentionally wanted to always speak Arabic from the very first time we met.
Okay.
And it does impress me. Very little non-Arabs would push to speak Arabic,
Okay.
whether Arabic words or Arabic, and this is a very nice.
Well, I do it because I know that people like it.
Yes.
People appreciate it.
Yes,
And,
we do.
I can't have a full conversation, but I can do the basics, do the greetings and the thank yous, and Jazakallah khair, and people like that. That took me a week to learn that word.
Jazakallah.
So Jazakallah khair, yes.
So, Robert, can you tell me more about yourself?
Well, I'm 58. Last week it was my birthday on the 13th of March. I've been living in Abu Dhabi for 18 years now. That's why I can speak a little bit of Arabic, not enough that I should be able to speak more actually. I should speak the whole language. I'm married, I've got 3 children. My wife is here with me. I've got all my children are adults. I've got 5 grandchildren. All of them are in UK. That's about it really. I left home when I was 16. I joined the army. I was in the army for 24 years. And when I left the army, I got a job here, doing the same sort of work for the police. So
we're here because you are a colon cancer survivor.
Yes.
And can we go through the process? How were you first diagnosed?
Okay. Well, it was about 2 years ago now. I was having problems where I felt like I needed to go to the toilet all the time, to sit down on the toilet. And after a few weeks, I decided, well, this is becoming a bit of a problem because I was going to the toilet but not actually doing anything. So I went to the doctors, which is a local Mediclinic around where I live in Al Nayam, and the GP referred me to come to this Mediclinic at Airport Road to have a scan. So I had the scan, and of course it was discovered that I had a tumour, and you told me all of that news, which was a bit of a shock. More of a shock for my wife, I think. So, because when you get told those things, you don't really understand how serious it is, or if it's not. So there's a lot of soul searching that goes on, and then when you start having your treatment, your priorities change. But as I was going through my treatment, I saw that there was a lot of people who were worse than me, a lot of people who were in worse condition. People lying down on beds, they've got no hair and everything. I felt like mine was very easy to get through because I never felt ill in any way unless I was having the chemotherapy. So I felt like I had it easy. I felt positive all the way through, I think.
Yes.
Tried to be positive all the way through. Sometimes you have your down periods where it kind of hits you, when you're at work or whenever it is, and you just think, my God, what's happening? I'm at work, I'm teaching people, but I've got this problem. Of course, it was a shock for my children. They were all very worried about it because they don't understand what the seriousness is of it. But my family does have history of cancer. My dad died of cancer. My sister's a survivor twice for breast cancer. But you work through it and hopefully it becomes all right in the end. If you remain positive, you get there.
Of course you do. At your diagnosis, you were diagnosed to have rectal cancer.
Yes.
And this is why you had this feeling or urge to go to the toilet, but
Yes.
there was nothing coming out, which you had previously, when we were talking, you had previously explained it very nicely, is that your cancer was sitting on the sensor pads.
Yes.
On the rectum, giving you the urge that your rectum is full. And you had to go and empty what's empty.
Yes.
Because cancer wouldn't just come out. You went through a complex treatment plan, especially because you've had also cancer in the liver, which was a direct spread from the rectal
Yes.
cancer to the liver. You had one lesion, if I recall, at segment 7, we call it, the liver.
Yes.
So, do you recall how did we plan your your full treatment plan? Do you recall how did we go on with it? Because it's not standard. Not every patient gets the same
Yes.
surgical plan. So, how was yours?
Yeah. Well, I guess the surgical plan is different for every single person because not everybody has the same problems. I think really it just started off with monitoring, and then we had the scans themselves. It was a CAT scan, wasn't it?
Yes.
That machine, by the way, is a very scary machine, very loud machine.
The MRI.
The MRI, yes, very loud machine.
It is loud and long.
Yeah,
long time.
Yeah, I was in it for an hour.
Yes.
And it's I had all of that, and then we started the chemotherapy treatment, which for me it was the worst part because that's what makes you feel ill.
Mm-hmm.
So I was going to work and I was feeling ill, and then going home, and then all I could do was just lie on the chair and watch the TV. My wife knew what was going on, and she was very patient with me. And then that followed on with the radiation treatment and then some small chemotherapy after that. Radiation treatment was, I thought it was very easy. You don't feel any pain with it. You're in there for 20 minutes maximum, I think, every session that I did. Of course, I had to have the surgery for the liver. And then a few days in the hospital, I had a stoma as a result of that with the bag. I've got to be honest, I didn't like that very much. But it's much easier to go to the toilet with a bag.
So can we just recall, you did chemotherapy?
Yes.
Then you did radiation.
Yes.
Chemoradiation. We call
Yes.
it chemoradiation. You had tablets, chemotherapy,
Yes.
beside the radiation.
Yes.
And then we had to wait 10 weeks,
Yes, that's right. Yes.
right? In the 10 weeks waiting period, I recall we did the liver surgery.
Yes, that's right. Yes.
So we did the liver surgery. We removed that segment with
Yep.
the metastatic liver
Yep.
lesion, and then at the end of the 10 weeks period, we did an MRI
Yes.
to see our rectum, how are we doing,
Yep.
and then we did the low anterior resection.
Yes.
It was laparoscopic,
Yes.
right? And in both situations, they were laparoscopic, the liver as well the rectum. Do you recall how many days you stayed in the hospital when we did the liver?
I think it was 4 days. I think for the recovery period. After that, for the first 2 or 3 days, I really could not get off the bed. I tried, because you said that you've got to start moving and start moving your stomach muscles, which I tried to do. And my wife actually was great with that. She helped me all the time. And of course, when you want to actually go to the bathroom, you've got to get up anyway. So, and then you gave me that small machine with the breathing, the sucking with the balls. That was great. I was determined to get the 4 balls on the first day, which I did. But yes, 4 days, and then I really just went home for another 2 weeks after that.
And then we did the rectum.
Yes.
And which surgery was harder, out of curiosity?
I think actually it was the liver one for me. I felt the most difficult with, because it's all around here, and you can't move much. It's difficult to move when your stomach's in pain, and it's hard to get up off the chair or off the bed or off the sofa. So for me, that was the hardest part.
In short, we had 3 surgeries for you then, right?
Yes.
So we had the liver surgery, the rectal surgery, and then the reversal of the ileostomy.
Yes.
The ileostomy is the bag we place which diverts
Yes.
your and the reason we did that because the anastomosis was very low, right?
Yes.
Remember, it was around 1 or 2 centimeters from
Yes.
the anal verge, and this is why we had to do an ileostomy. Your experience with us as a patient in Mediclinic, how was it?
I've got to be honest with you, it was fantastic. All the staff, everybody was helpful completely and understanding. Everybody was very professional. I'm glad that I came to this hospital. Mediclinic, they've been a great help to me, and my wife goes to the Mediclinic all the time now. She was here last week as a patient with a small operation on the back of her head last week, and she's fine now. So, fantastic.
Do you have any questions for me regarding your disease?
All I've got now is a small pain here, which we spoke about last week, which is is it suspected hernia or
it's a hernia?
It's a hernia.
It's a hernia.
Okay, so of course I'm going to need to come back.
It's an inguinal hernia. We will have to deal with it somewhere down the line.
Yeah.
We'll observe it. The pain is because it is growing and
Yes.
it is expanding, and that's why you feel with it. But that's for another time to deal with. But from the oncology point of view, from the cancer point of view, do you have any questions?
I've got to be honest with you. I think now it's just a case of monitoring. I've got to come back in May for another scan. Let's see where it goes. Take it from there.
It will be fine.
Inshallah.
One more thing I wanted to ask you. What would you tell people, patients, what to do not to be diagnosed in the late phase? When should they go to a doctor?
Well, I think as soon as they have any kind of problems, they should go to the doctor straight away and let the doctor decide what the future treatment is going to be. I think that they should go early on.
And with this, I will underline that part is because colon cancer symptoms are so vague. There are, in reality, every one of us would pass through these symptoms and think that they're natural and normal.
Yeah.
It's better to ask a doctor who's experienced in cancer to tell you, no, it's not cancer, and then you can deal with anything else in the future. Because the earlier you find it, the better the outcome.
Yes, definitely.
In reality, the better the outcome is less complicated treatment. Because it can be just a colonoscopy, you can remove a small polyp and it's closed. You can do a small surgical procedure and it's done.
Yeah.
So the outcomes are always good if we identify the cancer in earlier situations.
Yeah.
I would like to thank you in general about all of this. I've got nothing else to say in reality.
Well, you just thanked me and I owe you my life.
No, no, I am grateful that you trusted me. That's what I would say. I am very grateful that you trusted me with your life. And I hopefully, inshallah, this would be a good cure. Because if you recall, the pathology we had after we finished the treatment, you barely had any residual disease. And this will by itself translate to a very good outcome.
Yes.
And hopefully we'll have no recurrence of disease.
Inshallah.
Inshallah.
Another positive thing that's come out of it is that, as I said earlier, my sister's a 2-time survivor. My other sister has now been checked. She's okay. And my brother has also been checked. He's okay. So it's that message of go and get checked early while you can.
Yes, I tell when they come, patients, I tell them, you reach the age of 50. The birthday gift should be a coupon of go and do a colonoscopy or a fit test.
Yeah.
Because it is the most prevalent age, is the 50. It does come in younger ages. I've seen 25 and 27 as well.
Yeah.
But the majority of the patients are in the 50s. So it should be a gift, the birthday gift beside the cake and blowing the candles is a coupon for a colonoscopy.
Yes.
And then it is something which we don't like to do, but it can save lives and saves you from all the frustration and the discomfort of all this treatment.
Yeah. Thank you.
Thank you. So now we're sitting together, we're talking, and if we can share opinions together, and then if we can talk, how can we advise our patients, our population, to get examined, screened up front. And I think we should start with ladies first.
Okay.
Yeah, I mean, I agree with Rob, isn't it?
Yes.
If you feel anything, because I'm the type of person, or was the type of person who I would think, oh, it's nothing, it's just a little this or it's just a little that. I would say if you feel anything at all, just go straight to the doctor. It's better to be safe than sorry.
Yeah. And the earlier the better.
The earlier the better. Because I think to myself, had I gone a year ago, I wouldn't have had maybe the spread to the liver.
Yeah.
So I wouldn't have had to go through that liver surgery.
Yeah.
Yeah.
Well, I think I was quite lucky because I went I suffered for about 2 weeks with my toilet problems. And then I went to the doctors because my wife said, just go to the doctors. So I got there quite early, which was good for me.
It's great, yeah. I think with me it was pure because of my celiac disease that I just noticed it too late.
Yeah.
But I mean, I have heard people say, watch your toilet habits. And if you notice any kind of change in your stool, to go straight to the doctor.
I find out now that when I'm out with my friends, when we're socialising, people, they do talk about their health issues. And for me now, I just say, well, go to the doctor, go and get checked. You know my history now, go and get checked.
Yeah.
But some of them, they're still, I'll go next week.
Yeah,
okay.
The signs of colon cancer is so vague. The habits can change from bloating, constipation, diarrhea, a change in the caliber of the stool, a change of the appearance, indentation. There's many subtle problems which we have to look for. And I think it's better to go at even at an earlier stage. When I feel discomfort, pain, change in bowel habits, before I even see indentation.
Yeah.
Because at the end, it is a soft output, right? So when it passes through a thinner lumen, it will be thinner. So we don't want to reach that point where we are having a thinner lumen.
Yeah.
We're looking at, we're seeing blood and stool, especially if it's fresh in color. Especially if it's dark in color. Fresh in color stool is usually hemorrhoidal. So if it's darker blood, it's darker streaks of blood with stool, bloating, distension, really they're very general signs.
Yeah.
They can be anything. They can be a bad food, especially if it is repetitive.
Yes.
So if I've had this bloating today, tomorrow I'm feeling better. A week later I have another bloating, and then I'm feeling better again. It's worthwhile asking the question, do you have any problems?
Yeah.
Yeah. And with me, it was fresh blood. So again, even when I went to the doctor the first time, they said, "Oh,
It's
I
hemorrhoids.
think it's hemorrhoids." And then it kind of became too much, and I went back again, and that's when they sent me for the.
Sometimes it sounds weird. When I shake hands with a person, I shake hands and I go, this person has cancer until proven otherwise. And this is what I believe in. We should look for cancer first, make sure it's not there, and then you can go for hemorrhoids or any other disease. So we do try, and I cannot put it in the same context at the age of 50 as it is said worldwide. Even in the UAE, screening starts from age 50. But the majority of our patients are under 50.
Yeah.
So if this is a call for anyone, either the patients or my colleagues and doctors, is do not tie cancer to a certain age, because it can come at an early age.
Yeah.
As you see, we're sitting here above 50 and under 50.
Yeah.
And we both have cancer, right?
Yes.
And so it does come at any age. Our population in the UAE is tweaked towards the younger population.
Right.
So we see more of younger cancers than what is seen anywhere in the world. So please, if you have any signs, symptoms, any questions, any changes, it's always worthwhile to ask. Ask, get an answer, and forget about it.
Yeah.
Right?
Perfect advice.
Yes.
Yes. Yes.
Well, thank you very much, Dr.
Thank you.
Michael.
Yes,
It's
thank
been
you.
Absolutely amazing for both of us.
Yes.
Thank
Thank you. Yeah.
Thank you.
Saved both our lives.
Yes.
Thank you.
Thank you very much for your trust, for both of you trust in me. I recalled my first visit with you and as well with you. And I am very happy and proud to be that one little factor in your life which helped. And hopefully we will not see cancer again, right? And
Yes.
hopefully we're going to be cancer-free all our lives from now onwards.
Let's hope.
All right?
So,
Okay. Thank you very much.
thank you.